I have had 5 knee surgeries, 2 arthroscopic on my left and 1 knee replacement, 1 arthroscopic on the right and the knee replacement. And pain is what brought me here. I've actually seen several of the doctors here. I seem to be like an accident waiting to happen sometimes. I've had issues with my ankles and issues with my wrist, so I've seen two or 3 other doctors here, and then Dr. Jones. I've been very happy with them, very, very happy. And I mean, I've been here so many times. I've gone through therapy here, so I'm extremely happy with them. When they first called me and asked if they minded if the robot was in the room, I thought, a robot? Is he going to do the surgery? So she sent me a brochure and I looked it up and I thought, well, that sounds fine and everything. And I had full confidence in Dr. Jones, so I thought, why not? I did a lot of research before I had the first knee replacement in Vermont. And so I knew what was going to happen, because everyone said, oh my God, if you need to have both knees done, have them done at the same time, because after you have one knee, you will not have the second one. And I thought, that doesn't sound too good. So I did a lot of research and prepared myself, made sure I did exercises and had all the equipment, the walker, the cane, and what have you ready. I was very fortunate because I thought I did quite well with that surgery, and the doctor did as well. So when it was time, let's see, I had that done in 2015. When I was ready to have the other knee done, I knew what I was getting into, I knew what I had to do, so I prepared myself. And I think that's one of the most important things, is to know what's going to happen, to know that you're going to be uncomfortable. You need to do your exercises before and after, and just prep yourself mentally for the surgery. So when I had the surgery in April, I was ready for everything. I had everything ready, and I couldn't believe how quickly I recovered. And I thought I did, and the doctors said I did quite well with the first one. But this one was so much quicker, and not only that, I hardly took any pain pills. I was doing okay with Tylenol instead of opioids or anything like that. So I did quite well with that, and the recovery was fast. And my therapist, he said I was a poster child, because I was bending my knee and walking and riding my bike and doing things, I would say, within just a month or maybe a few weeks. Although I am an old lady, it's nice to be able to get up and not feel like an old lady, where you stand up and you can walk right away. You don't have to stand there for a while, bend your knee a little bit, and then walk. When you can move around easier, it just is so much better for your psyche. You don't feel like an old person, and I'm pretty active. I think that may be what wrecked my knees in the first place. I did martial arts for 4 years, competitive race walking, a lot of hiking, biking, I climbed the Grand Tetons. So I was always very active, so I find myself where I can move more and more easily. I've given several people advice on where to go, who to see, and that I feel like the experience was good. I think the doctors are quite up on orthopedic surgery and care. The hospital was nice, the staff was nice. I really like Dr. Jones, even though I did like Dr. Desmond too. But he just made me feel very at ease. And I think that's really important, to have a good rapport with your doctor.